Sound check. Check 1, check 2.
Well, hello once again, Joanne. Thank you for joining us.
I'm really happy to be back with you. It's been a long time. A completely different topic, but I'm happy to be here. Thanks.
It completely different topic because I think when I looked back, it was 2019 that we last, which
That's
would
probably,
place
yeah,
us pre-COVID, which is
yeah, pretty close.
crazy to think how that time has gone. So that people know, not that we have to disclose this, but you are, of course, married, the better half of Ken Bozeman, who has joined us on the show many, many times. And I got to say good day to Ken before he popped his head in and said hello. It was good to see him. But you are here, and I said this last time you were with us. You are here standing on your own steam because you have so much expertise in the area of singing and teaching singing. And last time we had you come on, you were talking to the area of menopause and hormonal changes for women, and that's still a pretty hot, passionate topic for you. And I'll get you to talk to that in a moment if you would. But of course, today we're going to talk into a really an emerging sort of topic around hypermobility and POTS and these sorts of things. But before we do, what can you tell us a bit more about you and what you've been doing and what you'll be doing?
Sure. Let's see. Lifelong singer, started out in a musical family, choirs and all that. I did a voice performance major at the University of Arizona. I started teaching in my junior year, so I was like 20 when I started teaching. So I've been teaching a long time. Let's see, I was a kind of a community-based teacher for many years and sang and performed and had 3 children. And so it was like juggling a lot of plates.
Yeah.
And then I began to teach at Lawrence University in Appleton, Wisconsin. My husband was already on the faculty. I taught there for 26 years, retired in 2019. I got into the hormone stuff just because my voice suffered from just going through the menopause transition, vocally speaking, and so I got into the writing business with 2 of my colleagues and wrote a book about that called Singing Through Change, Women's Voices in Midlife, Menopause, and Beyond. So that's my main jam. But now I've been researching and learning more about these other 2 issues as well. So I'm now retired from college, academia. I still teach. I have a small studio, but yeah. So I think that brings us up to date.
It brings us up to. You're busy, in other words.
Yeah, still
Retiring.
busy in retirement.
Retirement from Lawrence hasn't seen you, sipping pina coladas. Let's put it that way.
No.
No. We are gonna talk about this really important topic. I do want to just frame our discussion today, which I know you'd want me to. That neither of us are medicos. We're not going to be providing medical advice as a part of today's show. Certainly from my point of view, I'll be sharing some of my experience in working with singers with POTS and hypermobility. But certainly I can't claim to have expertise in this space. We're going to be leaning on you, Joanne, for the expertise. We also there's a paper. I'm just going to show it here. There's a paper, and I've referenced this in the description under the video that you, Joanne, shared with me, and I've read and found it really super interesting. One would it be too much to call it a seminal paper? Like it's a pretty important paper on the topic.
Yes. It's a qualitative study done by Jeffries et al. published in the Journal of Voice,
Yeah.
and it does a roundup of the medical information on hypermobility and HEDS. But she did a wonderful qualitative study on the experience of singers
Yeah.
and their subjective experiences of singing with hypermobility. And I think it's important to say, along with a number of them, a high percentage reported vocal difficulties, but 88% of them said they sang most days of the week, almost every day. So they continue to sing.
Yes.
And it's very important to them
Yeah.
and seem to help offset some of
Yeah.
the symptoms of the hypermobility difficulties. So
Yeah.
I think we have to keep that balance there.
Let's lay out some definitions, if you will, because there'll be a lot of people watching today's show who may never have heard of hypermobility, may never have heard of POTS and the other things that we'll discuss. Can you give us some easy to access definitions of some of the things we'll cover, do you think?
Yeah, I think we really do need to, and I had to learn all this myself.
Yeah.
I'll start with POTS, okay?
Yeah.
POTS is a form of what is called dysautonomia. And a dysautonomia means that for some reason our central nervous system doesn't handle the automatic functions so well. Something changes in that we can't regulate our temperature or our heart rate or our blood pressure. And there are a number of autonomic things that our body does. So I think of automatic, but it's autonomic is the medical term. So POTS is, it's an acronym, and I'll spell it out for you. So I have to use my cheat sheet here. Postural, P, postural, pertaining to the position of the body. Orthostatic, O, relating to or caused by erect posture. And then tachycardia is a relatively rapid heartbeat. And then syndrome means a group of symptoms or signs that occur together and then characterize the condition. With POTS, it is characterized if someone goes from supine or flat to upright, and if the heart rate increases at least 30 beats per minute in adults, and the blood pressure stays the same. Okay, so that's kind of the technical definition of it. So it's a difficulty with being upright or moving from being down to upright. And it causes symptoms like dizziness, again, that rapid thumping of the heart, brain fog. It can cause, I said dizziness, weakness, fatigue. So there are quite a number of symptoms that go along with it and other comorbidities, but that's the basic thing. It's like your body has a circulation problem.
Yeah.
And it's sometimes, it can follow trauma of an emotional trauma or surgery or an illness. It is now considered a comorbidity, a sequelae of POTS, COVID. Particularly long COVID has been associated with it. So we're hearing a little bit more about that because of, COVID has affected so many people.
Yeah.
So that is a quick roundup of POTS. Let me make sure I see heart palpitations, brain fog, dizziness.
Yeah, I think.
Oh, sleep disorders, sleep difficulties are also associated with POTS.
Yeah. Yeah.
So that's that.
Let's next outline hypermobility spectrum disorder, HSD. Right.
So a lot of people are hypermobile. Hypermobility just means your joints move more than normal. I have a little bit. I have a little bit of that. So a lot of people can be a little bit extra stretchy, but if it doesn't cause them a problem, it's just, we're fine. We're a little extra stretchy. But when hypermobility causes issues with your daily life, then it's considered a disorder. So we have hypermobility spectrum disorder. So it's a little more serious. And the spectrum means there is a spectrum of experience. So it could be very mild or it could be quite severe. So there's that box, okay? And the next box is Hypermobile Ehlers-Danlos Syndrome. And then I have to talk a little bit about Ehlers-Danlos Syndrome. Ehlers-Danlos Syndrome is a group of, I've heard 13 to 15. The most recent was 15 subcategories of what is a collagen disorder in the body.
Yeah.
And collagen, we have collagen in our skin, in our organs, in our blood vessels, in our connective tissue, so tendons and ligaments.
Yeah.
And so someone can have that, and then there's always some hypermobility and stretchiness involved, but hypermobile, the hypermobile sort of version of it is the largest subcategory. There's some special criteria that have to be settled before we get that diagnosis of hypermobile Ehlers-Danlos syndrome.
Yeah.
So the interesting thing about these two conditions and why we're talking about them together is they often overlap.
Yeah.
And so it's something like 30 to 50% of people that have hypermobility, HSD or Ehlers-Danlos syndrome, hypermobile, can have POTS, either diagnosis or symptoms that could be diagnosed as POTS. So that's what's kind of interesting about it. So that's why we often have to, not divide them up, but talk about them together.
Yeah. Let's dive in and talk about the I guess the challenge that this brings to a person who is suffering from these disorders, and in relationship to singing specifically. What are the immediate issues that a singer is going to face with?
Do you mind if I back up just a little bit and
please
talk about
do.
the general hypermobile thing? The thing that got my attention initially was I was listening to a radio program, and there were two physical therapists or physios, I think you call them, on just on the radio around them, and I remember them saying that it was more challenging to help a person with, first they said it was easier to help a person with super stiff joints versus a person that had extra stretchy hypermobile joints. And I went, wow, that's interesting. And they said it's because your body, and the muscles surrounding these super stretchy joints have to work extra hard to stabilize them. So it leads to sometimes pain. It can lead to fatigue, muscular fatigue overall. And then, of course, the joints can slip out of place sometimes and cause injury. And that really got my attention. And then, so that's sort of the general body part of it. But we can extrapolate to the voice, knowing that much about it. So for voice, and by the way, it is thought that in the performing arts, hypermobility, it's possibly more common in the rest of the population, because it can have some advantages. Okay, so say you're a pianist and you have a little extra stretch in your hand, your the joints of your fingers in your hand, you can get extras, you can cover more keys. Yeah. Or perhaps if you're a violinist, you can get in an interesting position, get a little higher, or you're more facile. That could be it as well. Dancers, think of the dancers and put your leg up by your ear, or that ballet leg, that hyperextended knee joint, right? Yes. So it's almost built in. It's almost an expectation. So, or gymnast might be a hypermobile. Mm-hmm. So, and it can be trained. You can, somebody who does yoga can get more flexibility. But we're talking about something that's a little bit more serious. Sure. Okay, I just lost my train of thought. For singing. With singing, let's take this extra stretchy joints that can manifest in the voice. This is sort of the good side of it. Extended range is often reported on the other hand. Sometimes restricted range is produced. I know that with one of my students that has it, before I knew she was hypermobile, I'll give you an example. I could, and she was a freshman, I didn't know her voice very well, but I would put her on a lip trill and she could just zing up to C7, just go right up there easily. But then the timbre of her voice, I'm going, no, I don't think she's one of those coloratorists, There's a particular timbre to the voice. And I go, no, this doesn't seem quite right. It's just like, it didn't fit together. And sure enough, I found eventually that extremely easy range on the top, very stretchy vocal cords, but she couldn't sustain the tessitura that a coloratura typically can. We had to
Yeah.
work a lot on finding stability in her upper range
Yeah.
because of it. So some singers can also go way low. And one of the quotes in that Jeffries article is like somebody said, I can sing all the sections in the choir. Now,
Yeah.
just because the voice can do these things doesn't mean they should. Okay,
Yeah.
I'll get back to that in a minute.
Yeah.
The other aspect that is positive is that really fast singers, very, very agile, riff all day. The woman I just talked to the other day, because I got coloratura off the hook. So meaning it just, you don't have to work hard at singing really fast. So that's another of the symptoms that is reported. Now, just because the voice can do something doesn't mean it should be doing it, because it may be stressing the tissues, it may be stressing the joints that allow this. It's very much like any other joint in the body. The physical therapists and the people that work with generally hypermobile people say you really should avoid going full range of motion. Just because you can put your leg behind your head doesn't mean you should do it, because it actually may cause an injury, a dislocation. It may cause, even small little injuries that are not even noticed. So far, and again, I'm not an expert on this, but we've talked to caregivers, we've read everything we can get hold of. And I need to mention at this point my research partner. I have to talk about Marita. So Marita Stryker and I are working together in doing presentations. She did her doctoral dissertation on POTS alone in singers. So anyhow, we've been trying to rake up as much information as we can on this. But that is often the recommendation, is not just because we can go so far with a voice, that just stay away from the extremes of the range. And just realize that the other thing with hypermobility is tends to be poor proprioception. Big word. It just means knowing where your body parts are. For some reason, hypermobile people have less awareness of that. So they may hold their shoulder in a funny position.
That's actually one of
they may get.
It's one of the quotes that I actually highlighted here in the article. Poor proprioception is also common in hypermobility, which can make it difficult for people to recognize that they are overly tensing muscles.
Right.
Yeah. Yeah.
And sometimes they're overly tensing the muscles in order to provide that stability, so it's keeping it in balance. Like one of the important things is to have a good core when you're hypermobile, so that and that's important. You can work on that with a physical therapist or a trainer that knows what they're doing. Okay, you can't just walk in any old gym and say, I'm hypermobile, I need a good core. You got to work with somebody who knows what they're doing. So, but that having good core strength is important for our everyday posture for hypermobile, but also for singing, because then we are able to, do good support when we're singing, not overdoing, not getting out of balance.
Yeah.
So, also, we may not necessarily feel when our muscles are fatigued if with that poor it's hard to say, proprioception.
Yeah, I know. I've always struggled with the word as well.
It's a great word.
It's a great word.
But it is, and right. And the other thing, as a teacher, you maybe have experienced this with your student, that because of this poor proprioception, singers who are hypermobile sometimes have difficulty explaining what something feels like. And we do this all the time as teachers, right? We say, okay, how did that feel that time? And it's like the words aren't there. So the advice from teachers who are hypermobile or who teach hypermobile students say, find other ways of describing, how did you experience that?
How did you experience it?
And get your word choice worked out, because these folks may be explaining things very differently than your regularly mobile people that you work with.
Yeah. what when you've worked with your students who were suffering from these I keep struggling for the right word to call them disorder symptoms. Condition. Thank you. That's the word I was searching for. When working with this condition, what are you noting in the voice, in its not at the extremes, but in the middle, in what we'd normally call the sweet spot, the prima voce?
Right. Well, according to these studies and also the teachers that work with them, I have to also mention Alien, and I'm going to try to say his name right, Partlijic. And
Okay.
pardon me, Alien, if you see this and if I butchered your name. He's also done a nice little research project on it. He is hypermobile himself, but he says that there can just be vocal inconsistencies, even like lesson to lesson. He says, "Oh, you get something worked out, think you got this thing pretty well solved, and then the next week it's gone." You know, so vocal inconsistencies, some instability and unpredictability of the voice, difficulties in the passaggi or the registration points. I have talked to several classical singers who have difficulty with the lower passaggio, so bringing head voice down and having chest voice take over, if you will, or get that mix. That's a very challenging part of the voice.
Yeah.
For them, the advice is bottom up, not like gangbusters, but don't be afraid of bringing that chest voice in for some more stability. And that's it's a very general recommendation, but that's what I've heard.
It's interesting because my observation, because being a contemporary singing teacher, I work with my students bottom to top on quite a regular basis, as opposed to top to bottom. And what I've noticed is that maintaining areas of, for example, belt, where we're maintaining that thick fold activity higher, can be quite challenging because the voice will fatigue quite quickly. Like it really,
that makes sense.
Really struggles under the stress and strain at a almost like a ligament level, as opposed to the actual vocal fold activity itself. Have you noticed that yourself?
Well, when you think about it physiologically, that makes sense. So when you say the ligament level, are you talking about the vocal ligament, the lamina propria?
Actually just trying to maintain that that positive tension, if I can use that term, that belt requires. It can be a real struggle. And I know for one student, they find that a challenge.
Well, that makes sense because we have, you're taking a mode 1 chest voice. That's the muscular part of the voice. And then as we go higher, and this is for all genres, as we go higher, that tensile strength transfers to the vocal ligament. The vocal ligament is made of, the 2 deeper layers of that lamina propria. It's very collagen heavy.
Yeah.
And if we have, a collagen issue or disorder, I can see why that might be a problem.
Yeah.
And some other singers, they have difficulty sustaining pitch.
Yeah.
And then or weakness in the voice. And so we don't exactly know.
Yeah.
And because these things are on a spectrum, it's going to be a little different from person to person. But I do know that it's probably very wise not to push through when feeling fatigued.
Yes.
Or perceiving your fatigue. It's late here.
And I
perceiving vocal fatigue and pushing through is probably going to be a problem. Go ahead.
Sorry.
Well, I mean, any vocal injury is not a fun thing to do.
No.
But with these tissue disorders, healing takes longer.
Yeah.
And so maybe it's even more challenging. And so continued vocal injury would not be something you want to entertain. So I'm kind of talking kind of conservative, but I don't know what else to say.
I wanna talk to the pragmatic approach that we can take. I want to talk to that in a moment. But before we do, I also want to just bring up that it's not an uncommon thing for sufferers of these conditions to also report GERD, gastroesophageal reflux disorder,
Yes.
as being
Yes.
significant for them, which then can lead to inflammation of the arytenoids, the vocal folds themselves, which only exacerbates further the struggles that they are having. And that's certainly been my observation. And I'm thinking of one particular student. His reflux is an ever constant challenge.
Yes. Right. Yeah, that's absolutely right.
Yeah.
I should probably talk about the vocal symptoms of POTS a little bit more.
Please do.
And we're talking about in Marita, my research partner's study, when she did this qualitative study and said, with your POTS, what kind of vocal symptoms are you noticing? And for them, the challenges are breath regulation, shortness of breath and fatigue, loss of range, loss of stability and intensity. And then the other part of it, because some of the symptoms of POTS are like the brain fog. And then because this autonomic system, stress or anxiety can tip us toward a flare. Okay, right. So POTS people don't just constantly have POTS for the most part. I mean, it can kind of come and go in most people. So you can imagine anxiety about performing, then could tip you that direction.
Yeah.
Staging requirements. So, if you're required to jump out of a chair, that may not be good for your POTS. So, and so it's all those things together. Staging requirements. If you come in and we're expected for some reason to always stand up in our lessons, right? I think about instrumentalists, wind players, they're sitting most of the time. For some reason, we singers are always standing. But there are ways to work with this. This is one of those accommodations, is and this is what I learned with my own students that have this. I would look at them when they came into their lesson and look at them. There was a look in the face sometimes, say, are you a little we say potsy. Are you feeling potsy today? And often they go like, oh yeah. It was almost like not being quite aware of it.
And isn't it interesting how so many of those symptoms you've just talked about, because you mentioned earlier how COVID can lead to the onset of POTS. And, so many of these symptoms we're talking about, fatigue, brain fog, sore joints. I mean, how similar is that to COVID? It's uncanny.
Right. It's all our central nervous system. It's everything kind of overlaps.
Yeah.
So we would just say, okay, this is a sit down lesson. Are you up to having a lesson today? Number one. Okay, we're going to sit. You can get a lot done, in the sitting position. Yeah. And there would be a few days where we would just agree it was better to go home and get our legs up.
Yeah.
It just depended, but I would say way more often than not, we could have a lesson. The other thing that we recommend, Marita and I had came up with some recommendations, is I think for sure for singers with POTS, and maybe both, is rather than, if you can arrange it, rather than 1 hour-long lesson per week, if that's what they're taking, 2 half-hour lessons and space them out. Afternoon is usually better for people with POTS because then they get their circulation stabilized as the day goes on. So, like if one day they're just feeling a little low, then you can say, okay, I'll see you later on this week, and we don't have to wait a week, and if you're just doing half-hour lessons, then have a backup lesson time that they can plug into if their one lesson time isn't good for them. The issue of disclosing is important, particularly in academic and professional situations. When you have these are invisible conditions, particularly POTS.
Yes.
Not everybody is comfortable disclosing. There are sort of pros and cons to that, but I think I would hope that a singer would feel comfortable disclosing to their voice teacher, just
Yes.
because it's such a, we can be helpful.
Yeah.
We can we can work with you on this. We need input going both
Yeah.
directions.
Yeah.
But there can be a feeling of and I remember this is what Marita learned in her study, that people that have assistance devices, say a cane or a wheelchair, that's something that is there, and you can tell somebody has some kind of disability. With some of these, we look fine, we look okay. And one of the sayings is, I'm not pretending to be sick, I'm pretending to be healthy. Because I know, we have to think about that. I mean,
Yes.
I have worked with these students, and Marita's worked with these students. I have interviewed, between us, we have interviewed a number of singers with these conditions, and I am so impressed with their resilience and their determination and their adaptability to do what they want to do. Singing is good for us in so many levels, and I can see why folks want to pursue it. Making thoughtful changes. It could be that for some people, singing with on a mic might be an easier kind of way to pursue their singing versus full-on classical, creating your own resonance and all that. But I do know operatic, classical, Western classical singers that are singing with one or more of these conditions. But Marita noticed that in her population, they tended to tip toward popular commercial music and some
Right.
musical theater too.
Interesting.
So I think we should encourage people and then also educate people
Yes.
about these conditions and advocate for singers
Yes.
as we can. And I know that advocating for someone with POTS that has brain fog and is having difficulty learning music, right? It's sometimes hard. And I've been through menopause, I know about brain fog. But difficulty learning music should receive an accommodation of some kind, because this is a medical condition.
Yeah.
And for people that are in school, if you're in high school or college, and then you go to your accommodations office and you get those worked out. But sometimes people would just won't understand why somebody in the choir's got to hold their music and everybody else is memorized, or just being more flexible with dates for memorization.
Yeah.
So, because it's a real thing.
It's a real thing.
It's not, folks are not making this up.
No.
These are not easy conditions to live with.
No. And I want to recognize and acknowledge that much of our strategic response to these conditions now is very, very much one of pragmatism and strength-based approach. It's firstly acknowledging that these conditions are in play, and then responding in that really pragmatic, well, let's look at making the adjustments, sitting down if necessary. The half-hour lessons is another one, but also being prepared to, because I can appreciate that people watching this would be going, yeah, but what can I actively do to, where are the answers? And the answers are in part, and I don't want to be trivial in saying this, but they are in part informed by the singer's resilient response to say, I'm going to adjust some of my expectations around what my voice will do, not just from this point forward, but today compared to yesterday, compared to tomorrow.
Right.
Do you have any other practical insights and ideas, what you've observed your students do that have been really positive for them?
Yeah, I mean, everybody's different, right?
Yeah.
We do, Marita and I put together, if you don't mind, we have kind of a list that we
Please.
found. By the way, an excellent resource on hypermobility is from the British Association of Performing Arts Medicine, BAPAM, BAPAM. Anyway, they have a good website, and a lot of this, at least regarding hypermobility, we found there. But let me, let's see. Teachers need to watch out for compensations, right?
Yes.
And just notice if something is getting tweaked a little bit more.
Yeah.
It's not uncommon for MTD to come out of hypermobile singers.
Yeah.
And it's probably in an effort to find some kind of feeling of stability.
MTD
So I know that's
being
kind of
muscle tension dysphonia.
and dysphonia,
Yep.
right? And I know there's some controversy about this, but I did talk to two singers just recently who have this diagnosis, and and we do also need to know when to refer to
Absolutely.
medical care, and then sometimes both of them are being sort of looked after by speech language pathologists who are just making sure that they're not over, they're keeping that in line. So mindfulness is really important in both these conditions, is to keep yourself calm, slow body movement like Tai Chi. And I'm going to mention yoga, but yoga has to be very modified because yoga is often about going as stretchy as you can, and hypermobile people need to keep it in the middle. So as long as the instructor understands, swimming is good, as we talked about earlier, Dan. Pilates is good for POTS because you do it on your back.
Yeah.
May not be for everybody, but it's one of the things that's mentioned. Light resistance bands for proprioception, very, very stretchy ones, but maybe wrapped around the torso or the belly or the upper ribs, just so folks can feel more what their bodies are doing. I remember when I first was looking into POTS, there was a woman in a Facebook group that said she was doing like cabaret sets, and she said, I found that if I wear a corset, I can get one more set. So having something like a Spanx type, what would you call it? When I was young, we called them girdles.
I think we've covered the three terms that I think everyone would be aware of. Yeah.
All right. Yeah. So just that can help actually with circulation, but also provides some stability.
Yeah.
Physically.
Yeah.
So that I thought that was totally worth repeating.
Absolutely. I love that one because it's so
right.
That's so
For sitting.
Simple to do for most people, right?
Right. Yeah.
Yeah.
And it may not help everybody. Now sometimes people wear compression stockings. That's a POTS thing. That can help. For POTS, hydration and salty snacks should always be available to them.
Yeah.
That's just an important accommodation. Sitting, we talked about that. This is what's kind of an interesting one. Repertoire choices. It was suggested somewhere that finding music that exploits a singer's communicative ability and emotional connection versus showing everything we can possibly do with our voice. That I'm just going to throw that out there.
Can I
practice that?
Can I suggest that's actually not a bad piece of advice for every singer?
That's right. I agree. We got to have those pieces, right?
Yeah, absolutely.
Kind of like, I'm not feeling great today. I'm going to say.
I'm going to communicate with you. I'm going to do it within an octave, but I'm going to communicate.
That's okay. Right. Also, practice guides. A lot of these you'll say, well, that's for everybody, but spaced, shorter practice sessions.
Yeah.
Not hour and a half at a time, but 20, 30 minutes, a little bit later in the day.
Yes.
And then if they're tired for whatever reason, at least they got 20 to 30 minute practice in. And that other one, then that's okay. We won't do that other one. Let's see, because we can do mental practice. It's documented. Mental practice is good practice, and memorization work, translation work for some of us. For people that are in productions, I think it's particularly important, I would say, maybe even more so for people that have POTS, is to have a cover or a cast. So that if they're having a rough day, that other person can take over for them. Flexible creative staging. Why can't a director have us sit down every once in a while? these, just kind of common sense
Yeah.
things. Teach our singers how to mark. Do we still do that? Do we teach them how to mark, go down an octave, instead of full on singing all the time?
Yeah.
Use of amplification for, I learned this from one of the teachers I talked about, because I always use amplification when I lecture in my classes. So just to save the voice somewhat.
Yeah.
We mentioned GERD, and we mentioned referring. If there is a voice difficulty that continues, what do you tell? 2 to 3 weeks that it's not resolving?
2 to 3 weeks, get it looked at.
Yeah,
Yeah.
and maybe even earlier for these folks,
Yeah.
particularly maybe the hypermobile folks,
Yeah.
because that injury can happen more often.
Yes.
And then just being, so much of this has to come from the singer. My student did a beautiful senior recital during COVID, and it was still when some of the singers were recording themselves, and she learned how to do video photography of herself. She pre-recorded the music and the songs with her pianist, and she picked all the songs to reflect something about what it was like to live with an invisible health condition. And it was absolutely stunning. Absolutely stunning. And she learned things from doing this, and not, it was a different kind of hard.
Yeah. Yes.
to,
Yes.
to do that in the long run versus, doing the stand up in front of the piano and sing for
Yeah.
an hour.
Yeah.
Anyway, I think I hit some. Are those helpful?
Oh, so very helpful. I mean, that's, that it's, again, I want to, I guess, highlight, the wonderfully pragmatic approach that we take to these issues and approach it from a strengths-based point of view, in so much of what can the singer do as opposed to what can't the singer do. It's certainly I think the responsibility of an informed singing teacher, along with the student, to be able to acknowledge what can't be done, because that's what empowers what can be.
Right.
And so I'm not wanting to, again, ignore the disabling aspect of it, but it certainly doesn't need to be the end of the road for people who want to sing, despite the challenges that it will present.
Yes, absolutely. I mean, a couple of the singers that Marita did for her case studies as part of her study actually are full-time performers. One, I can't remember if they're West End or Broadway or what, and one of them is in a wheelchair. That's how she's had her big accommodation, but she's found, if I can be in a wheelchair, I can do stuff. And that includes being a musical theater singer. And I also have another student who's just going through the steps of becoming a professional singer, and is doing quite well. And then there are others that maybe, due to the variability of these conditions, may not be able to do all those things.
Yeah.
But singing is important. We can be singers in all kinds of ways, right?
Yes.
And as I heard Marita say the other night, why do we have to stand up to sing? Right? I mean, be a choral singer. That's it. If that's what keeps you stable, if you have POTS, or if your hip joints are very impaired by hypermobility and it hurts to do something, then do it differently. And I think you mentioned normalizing. The more we can normalize these situations,
Yes.
the better off.
Yes.
If we, we can work hard at helping people understand we are differently abled, as we say.
I think it's important, isn't it, to recognize that optimal settings are variable. They're not fixed. What is an optimal setting for me is not going to be optimal for someone else. And it's finding
Exactly.
your optimal space. Where is your Goldilocks zone? And I'm so pleased we've been able to discuss all of this today, because I know, for example, we've got a long-time viewer here and she's been commenting, Mackenzie Kate, one of the first things she ever asked about when she became a part of the community here was POTS, because she is a sufferer of POTS. And there you go, Mackenzie. We've been able to finally answer with a little bit more depth than we've been able to provide before, because this is such an important issue. As you say, there are so many people in the arts with
Yes.
hypermobility, with POTS as comorbidity, and I was really tickled when I invited you on, and I said, what do you want to talk about? And you said, let's talk about this. And I went, yeah, every day of the week we'll talk about that. That's fantastic. So thank you very much for coming on and sharing the information that you've been able to gather. And I'm really looking forward to seeing where the continuing research goes for
Right.
what is still very much an emerging topic of understanding.
It is. One of my colleagues is an SLP who has POTS and hypermobility, and she's starting on her PhD in speech language pathology, and with the goal of doing more medically oriented research,
Right.
which we need, right?
Yes.
But also just connecting with other people, with other singers that have these conditions is
Yes.
also super, super important. And I'm happy to put, like, this woman you mentioned, I can put her in touch with Marita if she would like to do that, because Marita's doing the singer with POTS. That's
Thing.
her.
That's her
That's
thing.
her.
Yeah.
Her expertise, right, or her
Oh.
interest right now, and
No.
she is becoming an expert on it, I think.
Yeah. No, fantastic. Thank you
Well,
again.
thank you for the invitation.
Oh, thank you for accepting the invitation. It's been wonderful to catch up with you, and I've so enjoyed, having you on the show again and talking about today's topic. Thank you.
Thank you, and hi to everybody out there. Thanks for
I'll
joining us.
I'll just wrap up the show, and then we'll say our goodbyes after I finish up. Well, thank you everyone for sticking around and watching today's show. I know this was a topic of specific interest to ones like Mackenzie Kate, but I also know that it's important for us as a community to be aware that there are people around us who are working with these unseen challenges. And I think, if anything, for those of us who don't suffer from these conditions, I would hope that it empowers our empathy towards others and towards what other people are dealing with in their journey of learning to sing. Not everyone's journey is equal, and I think that's important for us to know. And I hope you've learned something today, as I have 100% learned stuff today. There's so much to take away from that discussion. Next week we're going to be doing a Q&A, and so I look forward to your questions when we join in again in 7 days' time. I hope you have a great week, everyone. I'll see you again soon. I'm Dr. Dan. Sing well.